My name is Nicole Payonk. I am with the Pennsylvania Coalition for Oral Health, and I am delighted to welcome you to today's webinar, Funding Dental Careers Opportunities in Pennsylvania. Before we dig in, a few housekeeping notes. The presentation portion of this webinar is being recorded, and the slides will be shared with registrants after the presentation. Microphones will be muted to minimize any background noise, so please make sure to use the chat box or Q&A feature during the webinar to share your thoughts or questions. So we're going to go ahead and we're going to get started here. Great, so let's start by looking at what's going to be covered during today's webinar. As always, it is important for us to level set. So we will be looking at the current dental training landscape in Pennsylvania and how that impacts our oral health workforce pipeline. We will then hear from speakers who will discuss the funding opportunities available to dental professionals to help address educational debt. And I will say we have had an interesting turn of developments today. Specifically, we're hoping that Laurie Madera from the Pennsylvania Primary Care Loan Repayment Program out of the Department of Health is able to join us. The Department of Health is committed to safety, and they are experiencing a fire drill right now. So we will be working to make sure, that if we're unable to hear directly from her today due to her partaking in that fire drill, you will have the opportunity to review her slides and information. And we can always connect you virtually with her if you have any specific questions. So I appreciate your flexibility as we work through this. And of course, after our presentations, there is always the opportunity where we love to have a group discussion to really explore the current impact of dental funding opportunities and how they support students and professionals in pursuing dental education, as well as maintaining a sustainable career in the state. So let's go ahead and we will get started at looking at, what we're going to be talking about today. So if any of you have attended a PCOH webinar in the past, you should be familiar seeing the Pennsylvania Oral Health Plan, the 2020-2030 Health Plan. It really is an important guidestone to our work and the initiatives that we do, specifically in the areas of access, prevention, education, infrastructure improvement, and really everything that goes into meeting the needs to meet the needs of our oral health workforce. And with that, I know we usually always look at it in terms of data, but it's our plan, it's our roadmap, and I'm really hoping that, with all of you here, we have the courage to take on some of the challenges, as well as the activities and strategies outlined in this plan together. So let's take a look at one of our maps. And this, again, shouldn't be something that's new for many of you, especially if you've attended any PCOH events before. This map is specifically looking at our dental health professional shortage areas. And what it tells us, or the picture that it paints, is that we need a lot of help as far as getting our provider infrastructure in place to meet the needs of our residents. 34 of the 67 counties in Pennsylvania are identified as a whole county shortage area. And what this means is that there are over 1.5 million Pennsylvanians that are residing in areas that do not have access to dental care. Now, we know that there are so many provider types, all of our healthcare professionals are dealing with shortages, and dental is not unique to that. However, when we look at it in comparison to some of the other shortage areas that our state is being impacted by, I definitely will say it's definitely very pressing. So if we look at the data from the Health Resources Services Administration, what we see is that it's going to take 3 times more dental providers to fill our shortage gaps in comparison to what we would need provider-wise to meet the needs of our primary care or our mental health provider gaps. And that really kind of gives us an uphill battle and the question of what do we do? What can we do to ensure that these gaps are filled and that we have a sustainable pipeline and we have regular access to dental providers in this state? So for me, the first step on, how do we begin to answer that question is to look at the dental workforce pipeline in and of itself. And I like to break the pipeline into 3 main priority areas, specifically looking at what do training opportunities look like in our state? How are we able to effectively retain students that we are training? And how are we able to develop a competitive landscape for dental providers that encourage them to live and practice in Pennsylvania? So this slide is an attempt to try and simplify what that pathway and what those factors look like. You can see here, the journey starts at exposing students or exposing individuals to dental professions with the hopes that eventually they can make their way through the pipeline to be able to enter our workforce and sustain a career with satisfaction. Now, the other part of this image you'll see, we have our green circles on the left and our red circles on the right. And those are those outside and inside infrastructure factors that are impacting our dental workforce to either incentivize them to join and provide services in our state, or conversely, it can also cause them to leave. Now, when I say leave, that could be they leave practice early due to burnout, a career change, or sometimes that also means that they choose to leave our state and continue their profession working in a different state. And while this is not a comprehensive list, the idea is to provide you a visual on the complexities involved at what it takes to meet the needs of our dental professionals, as well as our dental infrastructure system. Now, if you look at our cross sections here between our inflows and our outflows, you will see the middle of our Venn diagram with things like license portability or non-resident students. These are areas that can both support or hinder Pennsylvania's dental workforce pipeline. And in the center of that is the topic of today's conversation, which includes education costs. So that is something to consider as we move forward. What are the positives? What are the negatives? And how can we really develop these, again, to be competitive and to really meet the need of our current and future providers? So before we get into our presentations, I want to narrow our focus a little bit more and kind of give a brief overview of the different types of dental training that is available in the state, not only by looking at their geographic distribution, but also exploring the average cost and the average annual graduates by provider types. This information is crucial for us as we look to infuse the pipeline with more interested students, because in order to foster our future professionals, they have to have a good understanding of what are they considering when they're making the choice to enter a career field or choose dental as a profession. And I really enjoy this slide, not only because I'm just a visual person, but I love looking at where things are in and across the state. So Pennsylvania is very lucky, not only that we have multiple opportunities for dental school, but that we also can support the other provider types that we so heavily rely on in our workforce pipeline, including dental hygiene, the expanded function dental assistant, as well as just dental assisting. Now you will see, these are very varied as far as the cost of entry into training or even the number of providers that each of these, provider types are being produced annually. So one thing I will note, dental assisting is very flexible compared to our other provider types, because they are not, they do not require a certification or licensure. So there is a wide opportunity as far as entry into the dental assisting profession. And that can include attending a program at a community college. We know that some of our career and technology centers at the high school level offer dental assisting. And then there's also the opportunity for in-office training programs to, begin that career pathway. So that is also why we do have limited data specifically on average cost or the number of graduates that are being trained and entering the career path through dental assisting. And lastly, just to kind of round out and make sure we have, a good solid footing that we are all working from is, I know for me, it has been a while since I've taken on all of the terminology and paperwork that goes along with entering a career path after high school. So I just wanted to kind of review some of the common terms that we talk about when we're looking at financial aid or funding that's available for students. And, scholarships are a wonderful opportunity if they're available, because, this is money that is provided that we typically don't have to pay back. Then, of course, stipends are another opportunity to help meet some education costs. And the two terms that we will probably hear most today is loan forgiveness and loan repayment. So familiarize yourself. These terms will be coming up as we move through. And now that our stage has been set, I do want to welcome our speakers. So we have Caitlin Wilkinson, the co-director of the PA Primary Care Career Center with the Pennsylvania Association of Community Health Centers. And again, as I mentioned at the top of the webinar, I am hoping that we are able to get Laurie Madera from the Department of Health on this call. But again, we definitely recognize that there are things out of our control, like the Department of Health's fire drill, that may limit some of the information that we get to share. But Caitlin, thank you. I see that you came on. We'll go ahead, get your slides up, and just let me know, and I will continue to advance them for you.
Hey, thank you so much. Nicole, can you hear me okay?
You sound great. Thank you.
Fabulous. Well, thank you so much for asking me to come and speak. Very excited to be here this afternoon to talk to you about some loan repayment and loan forgiveness programs that are available to dentists and oral health professionals in Pennsylvania. So if you could please move to the next slide. Just a little bit about who I am and who I work for. I am Caitlin Wilkinson, as she said, the co-director of the Pennsylvania Primary Care Career Center. This was founded by the Pennsylvania Department of Health along with the Pennsylvania Association of Community Health Centers, which is the state's primary care association. And our main role is to help primary care providers such as physicians, dentists, nurse, medical assistants find careers in primary care provider locations, especially that provide care to medically underserved areas. We do offer and manage the largest database of job opportunities for healthcare professionals in Pennsylvania. We do list jobs and with 3RNet and PracticeLink. 3RNet is the National Rural Recruitment and Retention Network that is a job board specifically for organizations that serve medically underserved areas. We do assist candidates with job search, review CVs, resumes, cover letters, provide information like we're doing today on loan repayment. And we also offer career guidance and presentations to dental schools, residency programs, medical schools, etc. So I have our QR code to our website on this slide. If you have any interest in any of these services, it is free. We don't charge for our services, so feel free to scan the QR code and get in contact with us. Next slide, please. So according to a study done by the American Dental Education Association in 2022, the average dental student debt was over $293,000. And as you can imagine, education costs have increased since 2022. So the amount of student debt has undoubtedly gone up. And according to the Bureau of Labor Statistics, the median dental salary is just shy of $171,000 per year. So you're probably thinking it's going to take you past retirement to pay off some of these student debts. But I'm here today to tell you about a couple debt reduction options that you can help try to reduce some of that financial burden. Next slide, please. Here is just kind of an overarching list of some of the debt reduction options. The Pennsylvania Primary Care Loan Repayment Program, which hopefully Laurie will be able to join us and talk about a little bit later. The Public Service Loan Forgiveness Program, and then there's also a couple National Health Service Corps programs that I'm going to be going into detail about today. That could be another option for you as you move on through your career. Next slide, please. But to start off, the Public Service Loan Forgiveness Program is a little bit different than a loan repayment program, as Nicole alluded to earlier. Loan forgiveness meaning that after you meet the requirements and gain eligibility for this, the remainder of your student debt is forgiven. So it kind of just disappears. To qualify for this, you must be employed at a U.S. federal, state, local, or tribal government or non-for-profit organization. And this can include any sort of dental residency that you did. So if you did a year residency in a nonprofit, that would count towards your loan forgiveness program. You'll need to work full-time for that agency or organization, have direct loans or consolidate other federal student loans into a direct loan. You'll need to make 120 qualifying payments. Usually that translates out to about 10 years if you pay monthly. And you'll need to submit a certification and application annually or when you change jobs. I will mention for this particular program, the eligibility requirements are rather rigid. So if this is an avenue you're exploring, don't wait until the 10-year mark to make sure that all of your payments have qualified for this program. Make sure that you're taking a look at that currently. Next slide, please. And so the next couple of programs I'm going to talk about are from the National Health Service Corps, which is funded, I apologize for the typo there, is funded by the Health Resources and Services Administration. They support more than 18,000 primary care, medical, dental, and behavioral health providers through their scholarship and loan repayment programs. Before I jump too far into them, I did want to kind of do some level setting and talk to you about HRSA scores, which we'll go over in a second, so that you have a better understanding of some of the eligibility requirements for these programs. And I also did want to note that for all of the National Health Service Corps programs, you do need to be a U.S. citizen in order to qualify. Next slide, please. So I just mentioned a HRSA score. If you're not familiar with what that is, HRSA stands for Health Professional Shortage Area. It's a federal designation to identify areas or population groups that are experiencing a shortage of health professionals. There are 3 categories of HRSA scores: primary, medical, dental, and mental health. For this particular audience, the dental will be the most relevant. It can be a distinct geographic area, a specific population group, or a defined geographic area or not-for-profit facility. I will mention that all community health centers or federally qualified health centers have automatic HRSA scores, which range from 0 to 26. In Pennsylvania specifically, the dental HRSA scores are rather high, with 75% of our community health centers having a score of 20 or higher. The range can be anywhere from 11 to 25 in Pennsylvania. So there are many eligible employers if you choose to pursue these loan repayment programs to choose from. Next slide, please. So the first loan repayment program I want to talk about is just the standard traditional National Health Service Corps loan repayment program. You could qualify for up to $50,000 of loan repayment award for 2 years of service. Years of service means that you are employed full-time at a qualifying National Health Service Corps approved site, and you're helping rural and underserved populations. Federally qualified health centers and their lookalikes are automatically approved sites. So if you're working in a location like that, you know that you are eligible. If you are looking into working at a location that's not a federally qualified health center or lookalike, you'll want to make sure that they are a National Health Service Corps approved site. And you can often find those on their healthcare workforce connector. There is an additional $5,000 award for clinicians who are fluent in Spanish. So if you're fluent in Spanish, you could be awarded up to $55,000 in loan repayment. You're more likely to be awarded if if you're employed at a site with a high HRSA score, And the application period is typically opens up in March or April. So you'll want to mark your calendar for those. I do have a QR code taking you directly to the National Health Service Corps loan repayment site. So you can learn more about the eligibility requirements and see when the application is open. Next slide, please. The National Health Service Corps Students to Service. This is more for students in their last year of dental school. You could get an award of up to $120,000 in loan repayment. There is a 3-year commitment or service commitment instead of the 2 years in the previous slide in primary care. Again, all federally qualified health centers are automatically eligible service sites. This particular loan repayment program they are exempt from federal income and employment tax, and this applies to dentists specifically enrolled in their last year of dental school. Your graduation date will need to be on or before July 1st of this application year. So this application is actually currently open. The deadline to apply for the National Health Service Corps Students to Service program is November 7th. And again, there's a QR code taking you directly to that site. Next slide, please. This is more for anyone you know, or if there's anyone on the call that's still in school. There is a scholarship program through the National Health Service Corps where you could be awarded a payment of tuition and eligible fees, annual payment for other reasonable educational costs, and you also get monthly stipends to assist with your living expenses. There is again a 2-year full-time service commitment at an approved site in a HRSA area or a health professional shortage area. And the application period typically opens in the spring, so around March or April. I will also note for students who complete the scholarship program, they are eligible after their graduation and after their commitment with the scholarship program to apply for the loan repayment program as well to take care of any remaining medical student debt that they have. Next slide, please. So now that I've talked a lot about those loan repayment programs and I've talked a little bit about community health centers and federally qualified health centers, I wanted to provide some information on those locations to make sure that everyone knows what they are and why, and to kind of drum up interest, I guess, in looking into those as potential careers. As I mentioned before, these are all automatically approved sites for the National Health Service Corps programs. So these are, if you're looking into these programs, these would be great places to look into for employment. So a community health center, also known as a federally qualified health center, offers comprehensive quality medical, dental, and behavioral health care to everyone. And this is the important part, regardless of their ability to pay or whether or not they have insurance. These health centers are supposed to be offering fees based on the patient's ability to pay, usually using a sliding fee scale. The quality is ensured by federal oversight, so the Health Resources and Services Administration is also involved with the community health centers in making sure that they are providing top quality and medical care and meeting compliance requirements. These health centers also include integrated healthcare teams, so you'll often see medical, dental, and behavioral health all in the same building. A lot of them also have pharmacies or optometrists. Physical therapy is starting to become another one that's popping up, which is really great for serving these underrepresented, underserved areas. For example, if somebody comes in for a primary care appointment and they're malnourished, and the physician notices that a big part of that reason could be because they have poor oral health, they can send them right down the hall to have an appointment with the dentist to try to help improve their oral health so that they can also improve their overall physical health. And they can do that all in the same day, so they're not burdened with coming back and forth or waiting months for an appointment. So these are really important for the community. And speaking of community, another qualifier for these federally qualified health centers is that they have community control. So 51% of their governing board must be made up of people from the community or their patients. So it's community members making decisions for the community, which is very important. It's definitely very mission focused and patient focused rather than profit focused. Next slide, please. In Pennsylvania, we have 53 community health centers that operate at over 400 sites. So we are the largest primary care network in the Commonwealth, and they serve over 1 million patients each year. Next slide, please. And more specifically, the dental services that community health centers provide, you can see here there's a wide variety of services that are offered. They serve over, this past year, they served over 207,000 patients. And all this information is coming from HRSA's Uniform Data System, which is a public-facing website. If you're interested in seeing what kind of services and how many patients these health centers are servicing, you feel free to look that up. But you can see here on this slide the wide variety of treatment that they offer these patients at the federally qualified health center. Next slide, please. So you might be kind of wondering, after you hear all this, why a dentist would want to work at a community health center. These community health centers offer dentists work-life balance. Most of these health centers have, regular business hours and maybe a shared call schedule. So you'll get to go to work, but you also get to go home to your family and have a life outside of work as well. They also have job satisfaction. Many of these health centers are very mission driven. If you are looking to work somewhere where you're making a difference and kind of, like I said earlier, the patient is the center of the decisions and the center of attention and not necessarily making a profit, these are really fantastic places to work. And you also have a variety of different cases and a variety of different patients. So you're not going to be bored. It's not going to be the same day in and day out at these health centers. I mentioned before about the quality of care with it having federal oversight. You're offering top quality care with integrated teams and working as a team to help patients get the best health care. As far as salary and benefits, I mentioned earlier the Bureau of Labor Statistics, just shy of about $171,000 per year was the median income. You'll find that is right on par with what these community health centers are offering. If you are interested in a rural area, oftentimes the rural health centers will be offering a higher salary just because of supply and demand with dentists. They have, competitive benefits. Often CME is included with your benefits and CME stipend. And also your malpractice insurance is covered by the Federal Tort Claims Act. So that's something that you wouldn't have to worry about. And finally, like we've been talking about before, these sites are eligible for a lot of loan repayment programs. So that's another incentive to work here. And next slide, please. So thank you for listening to me. I have some contact information on this slide. If you have questions, feel free to visit our website, send me an email, give me a call. I'm happy to clarify anything, help you find a career in a health center, or answer any questions about loan repayment. So thank you for the opportunity to speak.
Thank you so much, Caitlin. That was really, really great. Definitely has my mind thinking on, a lot of different ways that, we can make sure our dental professionals and our interested dental students recognize that, there is a competitive landscape out there while also being able to, serve maybe a population they didn't intentionally, intend to work with, or maybe in an area where they didn't intentionally tend to, start and fulfill their career. So thank you so much. We are going to keep the presentation portion of our webinar rolling. Laurie Madera has been able to join us. We're so excited to have her from the Department of Health's Pennsylvania Primary Care Office. So she will be talking with us, and please feel free to include any questions in the chat as we, prepare to take on our facilitated discussion after our presentation. So Laurie, if you want to go ahead and just cue me on your slides whenever you're ready, take it away.
Great. Thank you so much, everyone. Thanks for having me. As Nicole said, my name is Laurie Madera, and I work in the Pennsylvania Primary Care Office in the Department of Health. So our job in this office is to identify areas of Pennsylvania lacking a sufficient supply of primary care providers and to operate programs to address those shortages. And I am the administrator for the primary care loan repayment program. I have been in this position for just a little bit over 6 months. And I don't know if Nicole said anything, but I did miss the first part of this presentation to run downstairs for a fire drill. So if I repeat anything that has been said, I apologize. But the primary care program really aims to increase access to primary health care services and improve recruitment and retention of healthcare providers in underserved communities. So I'd say the heart of the program is really increasing the number of primary care hours available in underserved areas. And so before I started this job, primary care to me, I immediately just think of medical care. But we do include dental and mental health care when we say primary care. So our program does cover those positions as well, or those disciplines as well. And so the way we do it is we offer grant funding to be used to repay qualifying educational debt in exchange for a 2-year full-time or half-time service commitment at a loan repayment program approved practice site in an underserved area. So we currently have both federal and state funding that's available for this program. The federal funding is through the state loan repayment program grant. And we have 1 year left on that, and then we'll be applying for it again when it comes out again. If you could go to the next slide, please, Nicole. Thank you. So these are just the disciplines that qualify for this program. So as I said, in the medical, dental, and mental health fields, and the emphasis is really on primary care, so not specialists or surgery or only treatment of specific diseases. So we look at primary care as day-to-day healthcare, family medicine, internal medicine, dentistry is in there, behavioral and mental health. So typically the provider is the first contact and principal point of continuing care for patients within a healthcare system, and then coordinates with specialty care as needed. So, you know, we include dentists, registered dental hygienists, and public health dental hygiene practitioners are eligible for this program that we have. And so primary care and we consider just like dental screenings, preventative dental services, pediatric dentistry fits into that category. But things that would not be included are like orthodontics, endodontics, and periodontics, so like dental specialty services. Next slide, please. Okay, thank you. So this site just talks about, or this slide just talks about who qualifies. So you must be licensed. You must already be licensed and not in training. You must work at a site that's already approved by the loan repayment program, and it must be in an underserved community. So before we typically have an application open in the fall for this program, and a site administrator would, before we open the program, need to submit a site application. Approved sites are generally in an area that's federally designated to be a health professional shortage area, or we also include in the state program if you have a significant percentage of low-income patients. So examples of community-based healthcare centers include the FQHCs, federally qualified health centers, FQHC lookalikes, free clinics, general dental clinics, certified rural health clinics, public health departments, the state correctional institutions. It can include group or solo private practices as well, and also hospital affiliated outpatient primary care practices, with the key being that is really outpatient services. So practice sites must provide comprehensive primary and preventative medical, dental, or behavioral health services to populations that reside in HRSAs. Or, as I mentioned, the low-income patients, there would have to be a minimum of 30% low-income patients. So patients who are uninsured or underinsured and receive services at no charge or through a sliding fee scale, so a discounted fee scale, and that's when patients' income is at or below 200% of the federal poverty level. So like Medicaid patients would be included in that, and the site administrator would enter patient numbers into our loan repayment system, and it will automatically calculate the percentages to see if it will meet the criteria to become a site. And we just emphasize that the site must provide care regardless of a person's ability to pay for the service. And you can actually look at our website to see a list of sites that are currently approved for the program. So if you're already working at a site that's approved for the program, you know, you're one step closer to being able to apply. The site approval lasts for 2 years, and then sites can renew as necessary. after the 2 years. And then the practitioners must agree to work for a period of 2 years at the approved practice site they work at when they apply. So working at a I do want to point out that working at a qualified site does not automatically mean you'll get a grant award, because the process is very competitive and not all eligible applicants receive an award. The number of awards that we're able to give out really depends on the funding available that we have at the time. As I said, we usually take applications in the fall through a formal request for application process. So that should be coming up soon. It's under review right now, but we should be releasing that fairly soon. And so as we get applications, we score them according to criteria, and then the awards are decided on starting with the applications that have the highest amount of points. Right now, we award 50% of the funding that we have to medical practitioners, and 25% to dental, and 25% to mental health. And I know Caitlin told you a lot about some of the federal programs, and just an important note is that you can only participate in one program at a time. At least from our point of view, you can only be in our program. You can't overlap with any of the federal programs. And then the next slide, please, Nicole. Thank you. So this is just what our awards look like. So for physicians, dentists, and psychologists, they can be eligible to receive up to $80,000 of loan repayment. That's if they are working full time, so 40 hours a week, 32 of which need to be direct patient care, or up to $40,000 for a half-time service commitment. So that's like 20 hours, 16 of which have to be direct patient care. And then the other eligible disciplines, so the hygienist level, are able to receive up to $48,000 of loan repayment for a full-time service commitment, or up to $24,000 for a half-time service commitment. And the way it works is when we award a practitioner, before they start their service commitment, we tell them how much the award is for. We come up with we have a grant agreement that the practitioner will sign, which is with the Department of Health. And then we give half of the amount at the end of the first service commitment year, and then the other half after the second service commitment year. And so we do have a process where we verify that the practitioner has been working at that site for the time agreed upon. And then we send the money out, and the money does have to be paid directly to the loan servicer. So when practitioners apply, you would enter in your loan information. We would verify the loans on the front end to make sure they qualify for the program. And then practitioners, as I said, pay the loan servicer directly, and then they have to send a verification that all of the money that they received was paid toward the balances on their student loans. And then the next slide is just my last slide. Just really, there are a lot of details that I didn't get into, but if you're interested at all, I really encourage you to look at our website. I will say the easiest way to get there, I know I didn't put it on here, is to just look up Pennsylvania Primary Care Loan Repayment Program. We've had a switch in our website, and it's a very long, there isn't just like a simple little website to put on. I can put it in the chat though. And then that's just my email address. You can email me that at our resource account, which you see on the slide, if you have any questions. I can also put you on our distribution list if you're interested in getting notification when we do open our next round of applications, which will hopefully be soon. So that's all I have. Thank you so much for having me. I really appreciate the opportunity to talk with you today.
Great. Well, thank you, Laurie, and thank you, Caitlin. You both have shared some really wonderful information on the funding opportunities that can support our dental workforce and grow our profession in Pennsylvania, which is really, what we're kind of all here to talk about and,